So the Doctor of Medical Science is an online program. It's designed by PAs for PAs that have finished their initial entry-level PA education and are seeking additional education in either advanced clinical practice, leadership, or advocacy. Healthcare is advancing rapidly, and at this time, PAs are an essential component of the healthcare team. This brings PAs to a level of parity, and it also brings PAs to the ability, in our opinion, that it brings them to the boardroom table. And we think that's where decisions are being made, and we think that PAs should be contributing to those decisions.
Hello, I'm Stephen Brunton. I'm a family physician and I practice in Los Angeles, California. I'm looking forward to being with CAPA again. I've been with you several times and it's one of my favorite meetings. I'm going to be talking about diabetic kidney disease, which is a huge challenge for all clinicians, particularly those of us in primary care. There are 37 million people with chronic kidney disease and type 2 diabetes is the most common cause. Unfortunately, 40 to 50% of people with CKD and type 2 diabetes end up with end-stage renal disease. CKD also doubles all-cause cardiovascular and non-cardiovascular mortality compared with just diabetes alone. So during my presentation, I'm going to be talking about screening and management tips. So at the end, you'll be excited, looking forward to managing these patients, which I think are a tremendous challenge for us all. So I'm looking forward to talking with you on September the 27th at noon.
I'm Jen Carlquist, and I'm so excited to be coming to you this year virtually. And in this year's lecture, I'm going to do something called EKG Mini Bootcamp. And we're going to spend an hour together getting to know the fundamentals of EKG interpretation. Because let's just be honest, can you ever really know enough about EKGs? And how can you find the big things that are really life-threatening to a patient if you don't have a strong foundation to work from? So in this workshop, you're going to leave knowing 10-step system approach that you can use when looking at any EKG. It's the same system I use, and it catches all the high-risk findings. Things like Brugadas, which is life-threatening. Things like hypertrophic obstructive cardiomyopathy. And if you do sports physicals, this is an absolute must for you to make this lecture because it might just help you save some lives. So again, super excited to see you guys this year, and I'll see you soon.
My name is Dr. Jeff Unger. I'm a family physician and a diabetologist. I'll be speaking to you on migraine and cluster headaches. You may be asking, why is a family physician and a diabetologist speaking about this important topic? The answer is very simple. You see, everybody in my family has headaches. My son, my daughters, my wife. If I can't fix them, I don't get fed. So this is a matter of self-preservation. I learned how to manage migraine so that their headaches go away very quickly. In my office, I can fix a headache in about 15 seconds. So please join me for this important CAPA lecture on migraines and clusters. I'm sure you'll find it entertaining, fascinating, and enlightening. Look forward to seeing you down the road. Thanks again for your time.
Hey guys, I'm David Doraguzzi. I'm a diabetes and endocrine PA in Upper Los Angeles County, and you know how sometimes it's really tough to know which medication to pick when your patient's type 2 diabetes isn't quite where it should be? Well, lucky for us, professional diabetes associations provide us with treatment guidelines to help navigate us through that difficult decision process. Well, I'll tell you what, why don't you join me on Friday, October 9th at 7 p.m. as part of CAPA's 2020 virtual conference, and I'll walk you through implementing diabetes treatment guidelines in primary care. I'll help make these diabetes treatment guidelines as easy to understand as they were meant to be. I'll see you then.
My name's Eric Glassman. I'm an orthopedic physician assistant. I've graduated in 2003, been practicing in orthopedics for 18 years. And my talk is going to be called cortisone injections, facts, myths, and the unknown. And I want you guys to become comfortable with knowing why we give steroid injections, the risks involved with giving in steroid injections, how they can help you and also help the patients, both therapeutically and diagnostically, to achieve pain relief in musculoskeletal disorders.
Hello, everybody. I'm Anita Nelson, Professor and Chair of Obstetrics and Gynecology at the Western University of Health Sciences. And I'm really looking forward to having time with you at the upcoming CAPA virtual meeting to talk about something that I think you probably see quite often and may even be bewildered by. And that would be how to diagnose and manage acute pelvic pain in women. There are just so many systems involved in that area of the body that having an approach that we can deal with on a more generalized matter and doing a case-based approach to learning this, I think is going to be particularly fun. So I'm looking forward to our time together, and have a great fall.